Get a leg up on your studying as we review bones of the leg today on Anatomy with Miss Rusty. Hi guys, welcome back. So today will be probably a more lengthy video as we go through the bone markings of the femur, the patellas, the tibia, and the fibula. We'll talk about the joints present and how to tell these bones right from left. Here we have the femur. Right now I'm looking at the anterior view. I know that it's the anterior view because this is the patellar surface. The patella is on the anterior side of the leg, so right now the bones are facing up. The head of the femur must point medially, so this kind of helps to direct which bone is right and left. So this would be bones from the right side, this would be the femur from the left side. Let's now go over the bone markings of the femur. We have the head of the femur, the neck, the greater trochanter, and the lesser trochanter. This can also be seen fairly well on the posterior side. On the posterior side, we also have two condyles that will form the knee joint with the tibia. The medial condyle on the same side of the bone as the head, and the lateral condyle on the opposite side. Let's zoom in on the patellas. I have changed the orientation, so now this is the front, and these apex of the patella point inferiorly. Looking at it from the front, it's going to be pretty difficult to tell which side of the body these are from. So what I'm going to do is turn them around to their posterior side. And now I can easily see. The side of the bone with the deeper indentation tells me what side of the body it is from. So this patella has a deeper indentation on its right side. So this is from the right side of the body. This has a deeper indentation on the left side, so this is from the left side of the body. So right now, our right and left looking at it is the same as the bones because this is the posterior side. The patella fits really nicely on the patellar surface of the femur. So this is a left femur that I have and a left patella. And you notice that the left lateral side has a little bit more of a part that sticks up. So the patella fits very nicely on that part of the patellar surface. Let's continue now to the lower leg. I'm looking at the anterior view of the tibia. We have this tuberosity here, which tells me that it is facing anteriorly. And then I can tell right from left based on these parts right here. These are called the medial malleolus. It's also what we would consider our inner bony ankle. So it must be medial, so therefore this tibia would be from our right side and this tibia would be from our left side. Let's continue with the bone markings of the tibia. We have the tibial tuberosity and the anterior crest, this edge right here on the front. As mentioned before, this is the medial malleolus. The condyles of the tibia are these flat parts up here that will articulate with the condyles of the knee. So the medial condyle would be on the same side as the medial malleolus, and then the lateral condyle would be opposite that. The fibulas might be one of the trickiest bones to tell right from left. This is how they are oriented in the body. The flatter part is going to go inward toward the tibia on either side. So the fibulas are actually the most lateral bone of your lower leg. If we look up close, this is a right fibula. So it's going to have an elongated part that must end up being on the posterior side of the bone. So this is our right fibula. This would be the left fibula. So here you see the elongation is now on the other side. So if I put it in its proper orientation, the longer side is pointing toward the back. So that is a left fibula. Going through the bone markings, the only two major things that we will discuss are the head of the fibula, which attaches to the top of the tibia, and then this is the lateral malleolus. This would be the lateral bony part of our ankle. Let's look at the joint between the femur and the tibia. This is the knee joint. It's a hinge joint that allows movement closed and open. This joint is between the condyles of the femur and the condyles of the tibia. There are 4 ligaments in the knee that connect the tibia and the femur. However, if an athlete or someone is running and their momentum is going in one direction but their lower leg is kind of twisted to the other direction, it's very common for the ACL or anterior cruciate ligament to tear. The ankle joint is formed between the distal ends of the tibia and fibula and the talus of the foot. So here you can see again, this is a right leg, and I'm going to attach the foot like so. So the ankle is also a hinge joint. However, we do call it a modified hinge because there is some slight movement that is able to be done in this kind of inward and outward direction. That concludes today's video on the bones of the leg, the femur, tibia, fibula, and patella. See you next time.